The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and thank you for joining us for the October 2023 OMHSAS Stakeholder webinar. My name is Josh Hubbard, and I'm an Administrative Officer with the Office of Mental Health and Substance Abuse Services. Thank you for joining us today. We will begin with a welcome and introduction from our Acting Deputy Secretary, Kendra Snuffer. Kendra, please take it away.
Thanks, Josh. Hi, everyone. I do want to say thanks again for joining us this afternoon for our quarterly stakeholder meeting. It means a lot to us to have so many folks on the line taking time out of your day. I'm Kendra Snuffer, Chief of Staff for OMHSAS, but as Josh just noted, I'm also serving as Acting Deputy, while Deputy Jen Smith is out on maternity leave. Just a quick reminder for folks that if any attendees have questions during the presentation, to please enter them in the questions box on the right side of your screen. So our first agenda item is actually to discuss the exciting new executive order from Governor Shapiro that created a behavioral health council. So I just wanted to give folks some information about the council if you haven't heard already. I know there's been some press and other announcements around it. So like I said, Governor Shapiro has established the council, and that council will create, help implement, and guide an action plan intended to remove the existing silos that exist across our state agencies, local governments, and healthcare providers and payers. And of course, with the goal of creating a more accessible, more easily navigated and responsive system to the diverse needs of the folks seeking services. The council will have a appointed full-time executive director, and that individual's name is Dr. Christina Finello. She was on the announcement call. We can certainly get more information about her to folks if they want it. But like I said, Dr. Christina Finello. The council is also going to be charged with really leading this transformational change effort that's going to use all of the existing work that stakeholders and folks have already put in to this end of breaking down silos. For instance, we know we had the Behavioral Health Commission under the Wolf administration, and there's lots of folks out there who have been trying to solve this issue of silos for many years now. So any information that's been pulled together thus far, we certainly want to see that hard work being used by this council as well. So Dr. Finello did say that she would like to get that information and gather it to help inform this council. I will say that OMHSAS intends to work very closely with this council. In fact, our work will be interwoven. So as we get any updates from the council or suggestions and things like that, we'll be sure to relay them on our calls with you all going forward. Just another kind of administrative note about the council, it will consist of both an advisory committee and then some appointed members. So in the executive order, and we can share the link to the EO in the chat here, but you can see all of the seats for which the governor is looking to fill to help both inform and lead this council. And that is all I have on the EO. So Jenna, do you want to take us away with some regulation updates?
Absolutely. So I know everybody is waiting to hear about the crisis regulations, and I've stressed this before, but this is a significant transformation moving us forward from the 1993 unpromulgated crisis regulations that we use as guidance now to license our programs. And we are very much building the regulations in adherence with the SAMHSA crisis roadmap, which I'm happy to email to anyone who doesn't have a copy of it already, or you can find it very easily by Googling SAMHSA crisis roadmap. So those regulations, we've just really been trying to be super intentional in reviewing them and reviewing them and reviewing them. But we are passing them off to the Secretary's office, well, into the ERP process this week, which is, you know, a big step forward. I'm also happy to announce that the psych rehab final rulemaking is making its way through the approval process. So we've entered that, you know, into there's multiple steps, obviously, in our approval process to make sure that we've thought of everything and, you know, dotted every I and crossed every T. And so, but the psych rehab are moving forward in that process. And we're also very close with, I know I get questions about the confidentiality regulations, just reminding everybody when Act 32 passed and Act 33, DDAP could do a bulletin, was instructed to do a bulletin, and we were instructed to add a covered entity's business partner to our confidentiality regulations. But after hearing from many of you about the awesome opportunity that Act 32 provided to update our confidentiality regulations to be in alignment with HIPAA, because ours predated HIPAA, we have taken that opportunity to align our confidentiality regulations with HIPAA. And they are very close to entering. They're not quite in the approval process yet, but they are very close to that as well. So those are the three regulatory packages that I think you all would be interested in hearing updates where they were and how they're moving forward. I will say many of you know we are also in the process of seeking CMS approval for modification of eligibility to be a certified peer support specialist. And that process is well underway as well. Well, it's not regulatory, it's obviously kind of a framework by which we must operate as we do work to implement the crisis regs and seek to have more people with lived experience working in crisis. That expansion is important as well. So I don't see any questions in the chat box. So about that regulatory update, I'm going to pass it off to Dr. Adair to talk about 988.
Good afternoon. Those of you who have known me for a while should be familiar with the fact that whenever there's a change in weather, such as we're currently going through, I get this chronic cough. So I'm going to apologize in advance if I start coughing while I'm talking. Hopefully it won't get to the extent that it sometimes does where I can't talk. So just a couple quick things about 988. Excuse me. So you all are aware that we've been working hard, the call centers have been working hard to try to achieve the goal of at least a 90% in-state answer rate. We've had our ups and downs. We have had, over the past year, have had 2 call centers who have, for a variety of reasons, have left the network. But we are currently at 12 call centers that are working extremely hard and are very diligent in that work. And I'm happy to say that our September report has us at an in-state answer rate of 86%. That is pretty much an all-time high for us. And when I last looked nationally at states, I think there are only 10 states that were at 90 and above. So, you know, we are currently at the doorstep. I don't want to jinx anything. So, you know, folks are doing a lot of good in hard work. I will also tell you that SAMHSA continues to push out funding to states towards 98, and at the end of September, we received our notice of award that we have a new grant, and I guess the appropriate wording of it is we have it from, for the next year, but then it's a 3-year grant. And the wording that SAMHSA gives is that as long as Congress appropriates the money, that then we would receive funding. Those funds are dedicated towards building out 988. So, and then the last funding piece is, you will recall that Governor Shapiro had put in his budget request, his budget proposal, that $5 million in one-time funds towards 988. We do have, we have received that $5 million, so we will also be incorporating it into the work going forward. So that's where we are with 988. There continues to be work. There's work going on to coordinate and collaborate between 911 and 988. And we have some regional meetings coming up with that. We will soon start planning some meetings for the spring that will be larger scale meetings around the entire crisis system. So with that, and my voice actually held up pretty well, I will turn it over to my colleague, Scott Talley.
Good afternoon, everybody. I actually have more than one item, but I'll start with the secure PRTF units. In the last webinar that we had, and we've also had some follow-up calls with BIMCOs and counties and primary contractors, we are going to start to allow to have secure PRTF units in Pennsylvania. We are still in the process of developing guidance, and we are also starting to develop medical necessity on the individual side. But we want to have that pathway for units. And so if you're interested in doing it now, we're not going to try to hold people up. If providers are interested, or counties or BIMCOs, I'm going to put Don Highmarsh's name and email in the chat. He's our contact for that. We will start to work with providers. We're going to be using some of what we have in our RTF regs that, as guidance, so we'll be able to share that at that time. But we want to have that pathway. So anybody interested, please contact Don, and I'll put that in the chat. Secondly, I wanted to let everybody know that our 21st Interagency Conference, the dates are set, and we have a save the date that has gone out and also a website. So just a little information, it'll be April 22nd through the 25th in 2024 in State College at the Penn Stater. We have a website, which I've also put into the chat, which includes within there applications for people who might want to present or speak, applications to become, if you want to enter a poster. You'll see the hotel is already in there with the block code. We'll be working to get things like scheduling up as we schedule and presenters as we get more information. The last time we had this was in 2019, and we had about over 800 people attend and got really, really nice reviews and feedback. So we're hopeful to have a good conference again, and so please check out the website. And then lastly, I just wanted to bring up that where we are with the PRTF regs is we're still in executive review, and I will provide further updates as they become available or as it moves through our executive process. And so I don't know if anybody has any questions. You can certainly put it in. I will make sure I answer. And if not, I will pass it back to Dr. Adair and Jenna.
I see
So,
Bob pretty fast. I think we can go ahead.
I'm sorry? So, Jenna, you want to go first?
Sure, I will go first about the TTI grant. I see there are many questions about 988 and 911 now in the chat, Dr. Adair. You know, I think many of you know that the National Association of State Mental Health Program Directors, which is the membership organization for offices like OMHSAS in each state, provides something, they're transformative grants, and they are one-time funding to do something innovative and transformative that states only can apply for. So OMHSAS has a long history of applying for these grants and successfully receiving them. For instance, last year we applied for the Crisis Intervention Worker Certification Grant that Temple is helping us build that on my OMHSAS. So any of the training requirements that will end up in the regulations for new crisis workers, they will be able to secure those required trainings online at no cost, thanks to that TTI grant. So this year, both Dr. Adair and I submitted applications. So I'll just speak briefly about the application that Policy submitted. I think obviously we all know that there's a workforce challenge happening. And when we talk about crisis services, you know, and I talked to many of you about crisis services, the two things that I said to me over and over again are workforce for 24/7, 365 service, right? Because crisis is all the time, and obviously fiscal sustainability. So as we look for innovative workforce strategies, we discovered that the Department of Corrections in the Commonwealth of Pennsylvania has a very, very robust certified peer support specialist program. It's actually the highest paying job within for inmates inside DOC. And they complete the same training as someone would complete who was not incarcerated, and they have to meet the same qualifications, and they then take the exam and get their continuing education. So some of those folks, you know, may be serving life, so 500 is a high number, but what our TTI grant is right now, there is no bridge program for those folks whose offenses do not prohibit them from working in behavioral health. There is no bridge program to identify the folks who would be appropriate to work in behavioral health and crisis services, or and then help them understand those options and bridge into that work. So we have applied for funding to work with the Pennsylvania Peer Support Coalition, Pennsylvania Mental Health Consumers Association, and Temple University to create a bridge for formerly incarcerated peer support specialists who are eligible to work in the crisis system. So that's, you know, we don't know if we'll receive the funding or not, but we do know that workforce is one of the focused categories. So that's the grant that that Policy submitted. Dr. Adair, do you want to talk about yours?
Excuse me. So some of you have probably heard me and others talk about some of the work that we're doing to try and address Black youth suicide. So Pennsylvania was one of 8 states that was invited, SAMHSA invited down to Baltimore back in July to their very first ever Black youth suicide policy academy, during which time we, it's a broad group, people from education are on it, from the school counselors, from school social workers, school psychologists, individuals with lived experience. I know I'm forgetting others on the work group, but the work group has we also have some university partners, including University of Pennsylvania. The group has expanded and actually continues to expand. We will be joined by NAMI Keystone, as well as others. So there were goals that were set, and to help achieve those goals, we've been looking at funding, so financial resources, and the TTI grants that recently came out. One of the topic areas included at-risk populations. So we submitted an application to help us achieve the goals, but the application was written with two specific at-risk populations in mind, one being Black youth, but also LGBTQ community. So we anticipate that we will hear whether or not we receive the grants probably in December, if they hold true to form. These TTI grants are managed by the National Association of State Mental Health Program Directors, or NASHPID, and they are funded through SAMHSA. So we, in the past, have held several different TTI grants, and look forward to hearing in December that we received this grant. But whether we do or not, we will continue to work on ways to address suicide prevention in these at-risk groups. So that's what I have as far as TTI grants. Jenna, you said that there were questions. I'm looking at my screen, and under questions, I have nothing. Under the chat, the only thing I have are the links that have been provided by our staff.
I've been answering some of the basic ones, but one of the questions was asked by Joni was, how much is the new federal grant and how will it be distributed? Because you mentioned the grant. So
the new federal grant that we received is a little over 4.8 million. The monies have to be applied to 988. So, you know, we just received that. We're going through and working with the call centers on needs, as well as, you know, the primary issue has really been around staffing. And so we are looking at ways of continuing to help them address those issues.
There's a question on the build out of 988. Will there be a function for people to turn it into something like Zoom? So I think maybe that's a good place to talk about the text and chat functions, because I don't believe it's intended to be Zoom, but we are working.
So nationally, SAMHSA and Vibrant have, for the deaf and hard of hearing, they have recently started, I don't know that the term I was about to say was pilot, but I'm not sure it's a pilot or not. But they have a video phone that is now being used. That's only being used nationally. No states, to my knowledge, are set up to do that. So that is the video piece. So there has always been the option of calling versus what we find with a lot of youth is that they prefer chat and text function. SAMHSA, sorry, excuse me. SAMHSA has, since last year, has been encouraging states to move 2 in-state chat and text, and we are very, very close to rolling out so that chat and text is answered in state. That will end up being a process, but currently there are 34 states that have moved, are in the process, or have already gone to doing in-state chat and text, and are working to build up their capacity to do that. We are very, very close.
Let's see. I think that answered that one. There was a question about, was the funding per year or just 1 year, or is it multiple years? And I clarified that one already.
Yeah, it's a 3-year grant. Again, as I said previously, SAMHSA's disclaimer is that as long as Congress continues to provide the funds. But this first year is 4.8, I think it's 4.84. Next year it's scheduled to be 4.7, a little over 4.7, and then a little 4.7 the following year. For some reason, they provided a little extra boost in our first year of this grant.
Yeah, and there's some other questions about, is that funding just for 9/8 or beyond? And I think it's an important point for, like you did say, Dr. Adair, that the funding, the federal government is not just thinking about 9/8. I mean, the funding, the first year is really focused on making sure our answer rate, you know, everyone knows that our goal is 90% by the end of 2023, but then they also want us connecting to mobile teams and having the ability to track when a mobile team is deployed, how long it takes them to respond.
Let me qualify that though, because our grant project officer has made it clear that these funds are 9/8 specific. So I think there is some other clarity that as we move along, we will find out where exactly these funds can and cannot be spent, but I don't want to leave you with the impression that these funds clearly can be used outside of 9/8, because that is not what I'm being told. But
so to clarify though, they could help 9/8 track what happens to the 9/8 calls, but not fund like mobile crisis or something like that.
Correct. So, but I think that as time goes on, we will get more clarity. There's some other questions that we have that we don't have clear answers to yet. SAMHSA will be holding webinars with the awardees to provide some of that clarity, but I think there will continue to be questions in that regard. But again, I don't want to mislead anybody.
Important clarification for sure. I think that's touched on all of them, unless anyone else has a question they haven't typed yet.
Thanks, Jenna. This is Kendra again. As Jenna just said, I just want to make sure, give folks another minute here to put any questions they may have into the chat box. This is your opportunity, so please don't hesitate to reach out. All right, well, I don't see any more coming in. So at this point, we can end the webinar, but thank you everybody for attending today, and we will see you or talk to you soon. Thank you.
Take care, everybody.